Cancer. This can be a pretty scary word for most people. Now, soft tissue sarcomas are a type of cancer that can develop from tissues such as muscle, fat, nerves, blood vessels, and other connective tissues. It can occur anywhere on the body, but most commonly in the arms, the legs, the chest, and the abdomen. This tumor is very aggressive, and therefore treatment has to be very aggressive. Surgery is the most common treatment for soft tissue sarcomas, but if they occur on the arms or the legs, that could mean amputation of the affected limb. Radiation therapy is often used after surgery to kill any cancer cells left behind, but this can result in severe local reactions. Chemotherapy can also be used to kill any cancer cells left behind, but this can result in severe reactions throughout the entire body. But soft tissue sarcomas don't only affect people. They affect other species as well, such as dogs and cats. As a veterinarian, I have a particular interest in cat-related sarcomas because they often occur at the site of an injection, such as with a vaccination. Injection site-associated sarcomas are particularly aggressive, and just like in people, have to be treated with a combination of aggressive surgery, radiation therapy, and chemotherapy. And despite all of these treatment methods, we still get regrowth of the tumor. This can be physically, emotionally, and financially draining. So my research involves looking at a new treatment method to deliver a high dose of chemotherapy directly to the tumor bed to avoid all of these other aggressive treatment methods. We would do this through the placement of chemotherapy beads, as seen in the upper right-hand corner of the slide. These beads contain a chemotherapeutic drug called carboplatin, and they are made out of plaster of Paris, so they're biodegradable and relatively inexpensive. So in phase 1 of my research, I wanted to find out, would these sarcoma cells in culture be sensitive to the chemotherapeutic drug contained within the beads? And we found that they were. In phase 2, we placed the beads into a gel diffusion model to mimic how that chemotherapeutic drug would diffuse into the tissues around the bead. And that helped us plan for phase 3, where we implanted the beads directly into cats. And we found that not only did it deliver the chemotherapeutic drug to the tissues, but it also did not result in any major side effects at the site of implantation. With this novel treatment method, we hope to avoid all of these other aggressive treatment options and offer an alternative treatment method to locally aggressive tumors, as well as potentially even to other species, such as dogs or even people. Thank you.